we've talked a lot about prostate cancer. Let's go back a little bit and talk about prevention. What can people do to better their odds of not getting prostate cancer?
I hope not everything sounds like I'm being tangential, but believe it or not, this is what's so unique about this field of prostate cancer. It's the assessment. The best thing to do to avoid getting prostate cancer is not to be biopsied unwarranted. I can't stress that enough. If we all have cancer in us, then the worst thing you want is a biopsy that finds one of these moot cancers. That's the best way to prevent a problem. So therefore, to prevent that, you don't trust one PSA. I sound like a broken record, I know, but that's what it comes down to. So therefore, one way to prevent it is if you only have one PSA, or you think you can only afford one PSA, don't get a PSA. That in itself is essentially kind of a reverse treatment to stopping a cancer that is not really a cancer, and you'll have more damage from the surgery than anything a cancer will do. It's a very warped way of looking at this, and when you deal with this long enough, you realize that in itself is a treatment. Don't get it. Now, if you're able to have PSA tests over time, that's fine, and then if they find cancer, that's a different story. But further, as far as what you're asking more for prevention, one is to lead a healthy lifestyle, of course. Try and make sure that your sex hormones are balanced. If you feel that you have emotional swings, maybe look into that. If you have difficulty sleeping, the melatonin difference can throw off your hormones as well. It's possible. Also, for men, be very careful about, this is a really important point, watch taking testosterone. Now, the baby boomers all want to be 20.
Sure.
Can't blame them. I mean, I still want to be 20. I mean, but you turn around and you start pumping up this testosterone, these testosterone clinics. It's cheap money. For a lot of doctors that are struggling, they all, cheap money. Baby boomers want a quick erection and quick libido and age reversal. It's a match made in prostate cancer heaven is the way I see it, because testosterone does not cause prostate cancer, but it can make a cancer worse once you have it. It's like throwing fuel on a fire. So therefore, prevention in many ways is to be very vigilant and have a doctor that really is watching out for you when dealing with androgen treatments. That includes testosterone and DHEA that you can get over the counter. People are buying DHEA, and I'm not in favor of regulation, but they're buying hormones. They don't know what they're doing, and that could fuel a cancer that they don't know. One last point, too, is with exercise, is swimming, hiking, as I said, anything to open up the pelvic area. And one last point, which is debated, this will be a nice little coda for you if you want to put on. There are a few arguments that people have in naturopathic medicine, where most areas of natural medicine, aside from modalities, but the concepts of natural medicine, usually are always coherent. Everyone agrees that you shouldn't smoke or exercise is good. It's unanimous. But there are a couple areas we kind of disagree on. And one is about the role of orgasms. We hear often, are orgasms good or bad for prostate cancer? As I said, that's what the prostate does. And so naturopathic medicine is almost schizoid on this issue. Because on one hand, our roots come from Ayurvedic medicine and Chinese medicine. And from that root model, they believe that every time a man has an orgasm, you're actually extinguishing or losing a part of your what's called jing, which is your sexual energy. And in Ayurvedic medicine, I believe they've said for every orgasm you lose like 3 minutes off your life or something like that. And for some men, we've joked they should be dead by now, is what said once. But at the same time, in all seriousness, on the flip side, the American view of nature cure says the opposite, which is that stagnation is the root of chronic disease. And you have to keep everything flowing. If your digestive tract is backed up, you're constipated, toxins. If your emotions get backed up, obviously holding emotions, you'll have chronic disease. And some people even claim spirituality. You back up your own spiritual views or culture. That's a loaded issue in itself. But everything needs to flow. And hence, the same thing here. If the prostate does not flow in any manner, then that can cause stagnation, hence ultimately an increased risk for prostate cancer.